one of the issues we know our patients face is fear, right? So whether that's fear of relapse, fear of their progression, or sometimes there's other things that trigger fear for patients, like the fact that they might die. In the survey, the global patient survey that we do, specifically, we do ask about their fear. And most patients report either experiencing fear of progression or fear of relapse. Most patients also report that they don't talk about it with their doctors or their medical team overall. If they are looking for support anywhere, they're more than likely just to talk to their family and friends who are obviously not trained to help them. And then they're continuing to try and deal with these issues. When we look at fear, one of our main things going back to our patients is one, to try to get them to voice it. Talk about it to somebody on your medical team, because there are avenues of support. Of course, there are psychosocial supports available in the hospitals. We know people have limited budgets and those might not be available to everybody. There are community resources, though, available for patients as well. Many patient organizations have support groups or one-on-one counseling for patients that can be helpful. We encourage always people to look and see what kinds of community resources are available to make sure you're signposting patients to the best support they need. Oftentimes as well, the fear comes from a lack of information. And so patients are wondering if they have a side effect of a certain treatment, or they're still experiencing a symptom of their disease. Is that normal or not? Should I be worried or not? And when they don't have the answers to those questions, their fear continues to grow. So providing really good information and sometimes repeating that information is going to be helpful for our patients to help them cope. And hopefully if we can get them help coping with their fear, it also will reduce any depression and anxiety that they have. But also there's some literature showing that a reduced fear also helps contribute to better outcomes overall for patients.